Hello, good afternoon, and welcome to our webinar, the third in our series of sales and marketing for home care. And the one that we are presenting today is about becoming a trusted advisor for referral sources. So I'm really happy that you all are with us today, and I'm just going to do a little bit of housekeeping before I introduce myself and my fellow speakers. I do have everyone on mute mode, which means that we will have a clean broadcast because we do record these broadcasts, so you can share them with your staff later, or you can look at them later if you would like to repeat if you missed something. We do not send these PowerPoints out. We won't email it to you, but we do store them on our website, corecubed.com events. So you may go there and actually not only see this webinar, but you may see other webinars as well that we have done in the past. So thank you so much for joining us. My name is Marilee Orsini, and I have the privilege of working at CoreCubed, an organization that I founded and started when I got out of being a private duty business owner, which was, I started that business in 1981 and I sold it in 1996. And from 1998 until present and ongoing, I've been working at CoreCubed and working with agencies, aging care services businesses really, but especially we love home care, so we've been doing a lot of home care business. And we work with agencies on how they can be successful and how to be better marketers. And I used to call myself a home care futurist until I watched a TED Talk last week, and he said, you know, he didn't like the word futurist, he liked the word nowist. So I am actually a home care nowist because I do love home care and I am very involved in what's happening in the industry. So I am appreciative of your attendance today, and you are going to be in for a treat because we have two people from CoreCubed, our co-managing directors, joining us. The first is Amy Selly, and she is an expert also in marketing aging care services, has been in this industry for a long time, since 2001, and working with her is such a pleasure. Amy, thank you for joining us today.
Thank you for having me.
Amy knows so much more than I do that I'm learning every day from her, so it's really wonderful to have your quality and level of expertise on our team working with our clients. And Marissa Snook. Marissa is, as I say, another managing director. She's also our program administrator, and she has been working with our MOST program since its inception in 2007, and that is, if you don't know about our MOST program, specifically for home care businesses, and actually what we're talking about today, how to become a trusted advisor for referral sources, that is one of the things that MOST allows our clients to do. So I urge you to check that out. Marissa, thank you for being with us today.
Happy to be here.
We are really going to talk about building a base of referral sources, and the key is you really want those referral sources to know you, to trust you, and then to refer to your services. And so what we're going to talk about today is how do you become a trusted advisor, and also what are some of the referral sources that you can get to by being a trusted advisor, and what are some suggested ways to do that.
Marilee, if I can jump in for just a second, I think one of the ways to become probably one of the most important ways to become a trusted advisor is to look at yourself that way, to start looking at yourself not as a salesperson, but as an advisor and a partner to the people who you're visiting.
Very good. This understanding the buying process, and this is particularly true in home care, and we have a wonderful graph that I'm going to show you in a minute, but I think what you need to understand, you need to understand where people are in that buying process and why they are where they are, and a whole lot of that has to do with why they're looking for care in the first place and what they know about care options. Home care is something that people really don't know about unless they've experienced it, and then their experience is usually narrow. So whatever their home care experience was, they think that's the same experience that other people are going to have. And so those people that are coming in to look for care may not know very much about it. And this is where the referral sources do come in, because they might already have someone that they trust or know and that they will turn to, and they're going to ask that person for information. Understanding this consumer purchasing process, which is really the same in some ways also for referral sources. So this is specifically about business to consumer marketing and the customer experience lifestyle, but what I want you to pay close attention to is that first awareness of need. So, and go back to my slide previously that says, where is someone in that process? And that awareness that they have a need is really when they start researching, asking questions, looking for people who've had home care before, trying to find out as much as they can about what would be the appropriate solution for their specific care need.
Right. Seeking resources, looking for education about what they're encountering.
And their search will be specific to what their need is. If they have a mother with Parkinson's disease, that's what they're going to look for. If they have an issue with a parent or a spouse that has a dementia, that's what they're going to look for. So it is that first circle and that second circle that is where the marketing strategy comes in. Sales starts when people are talking to you about their options. It really rocks when they're deciding who are they going to pick, and then the operations of your agency take over at that point, and how you are performing is going to be important at that point to keep that customer. So that this is that strategy that you really need to understand. And again, for home care, it is different than for other products and services, and specifically because of that awareness factor. The other thing that makes home care a difficult sale and something that is harder for people to wrap their arms around is what the options are. So you have really, out of the general population, you have very few people who would have care needs. That number's growing, obviously, as the population ages. But once a care need is determined, someone knows they cannot stay at home alone, and are they going to have to move, or what are they going to do to stay at home, whether it's recuperating from something or it's a long-term chronic issue, then that's where that care need develops. And then those people with care needs, they really have two choices. They can stay at home and find some way to do that, or they could move elsewhere where someone else will provide a safe environment for them and the care that they need. If they move elsewhere, they still might need help, assistance. That's where, eventually at the end of life, hospice will probably come in, but then there's all kinds of care needs associated before that. And if they stay at home, they have a lot of options too, depending on their ability to pay. So they're either going to hire an agency. If they're eligible for Medicaid, that's probably what they'll do if they're going to stay at home and get some other community services. If they can afford to pay, they might hire either an agency, private duty agency. They might hire their neighbor. They might hire an independent contractor. They might go through a registry. So they have lots of options. So this to me shows why it's so confusing for people, because it's not like when you have a child and you know you want to go to work, you're either going to hire a nanny to come in, you're going to put him in a daycare center, you're going to have, there's just limited options. You also know the child's going to grow and prosper unless they have an issue, and it's not a complicated process, and everybody knows about it.
Well, and now there's so many new choices for people. I think as the population of elderly grows and the amount of caregivers shrinks, then in comparison to the number of elderly, then there's a lot of new options that are going to be thrown into this mix. Small group homes, community, organizations where people work together to help the elderly in a particular community. So it's going to be even more complicated.
Yes, it is not going to get less complicated. That is for sure. Okay, so let's move into what we're talking about today about referral sources. Well, traditionally, these are your referral targets within the healthcare continuum, and this is really where most people go or think about when you have an agency and you're thinking about building a referral source base. We're going to talk about a lot of other ones besides these, but this is really the key, and the reason, obviously, that so many people are going to come through this is these are people are if they're in the hospital, they got to leave. They were in the hospital for a reason. So I mean, all of your referrals from this group of healthcare providers in the healthcare delivery system, people are coming through there. So the numbers that come through here are going to be greater.
Yeah, and I think one of the biggest challenges when you're visiting and bringing things to these referral sources is that the talking points and the educational resources that you might bring are different for each type of target, and that's where knowing your audience and listening to them carefully comes in, so that you're talking about the right things and bringing the right things with you when you visit.
Excellent point. I would like to say, though, that from my history in doing this for decades now, as competition increases, there are more and more people targeting this specific group, these groups of people. And oftentimes these groups of people really don't understand what's the appropriate referral. And that is where becoming a trusted advisor will help within this group, because they may not understand what's Medicare eligibility, what's Medicaid, what are some other community resources, when is someone eligible for hospice, what are there ways to pay for private duty outside of just, family funds. So this is really a group of people that are ripe for understanding that if home care is appropriate and what is the best place for their referral, the person referring that patient or client, where is the best place for them based on whatever their physical condition is, if they have resources to pay for services, what their formal support and informal support systems are, those types of things that would go around understanding what's the best place for someone to go and what's the best location for them to have care.
Yeah, I think it's pretty normal that these groups of people, become kind of siloed in their own positions, and you might think that a physician's office or a nurse case manager knows a lot about home care, but you'd be surprised how much they don't know and how much education can be provided to them that will help them.
Actually, I bet anyone who's on this call who runs an agency would not be surprised. Because they've probably encountered it and wondered, how did this happen? To get into these groups, though, I think there's a long-term sales process to do that, but my recommendation is that you really have to realistically measure your chances of reaching each of these, because you'd like to be successful in your efforts. And it's key here, Amy, you said earlier, listening. You have to know what's going to make their job easier, and how is it you can help them, not how can you sell your services to them. Didn't you say how can you partner with them? Was that?
Yeah, well, I think you first have to look at yourself as an advisor, and so if you're an advisor, you're an expert, and how can you expertly advise them? instead of just selling to them. And in order to know how to do that, how to advise them in the right way, you have to listen first.
And you really have to understand what is it you can bring to them that will help them and help them do their job better. Also, it obviously helps if you have an inroad. And we're going to talk a little bit about inroads, how to make some inroads if you don't have them in a minute. But you really do need to narrow this down. Take that list and narrow it down and talk with them. Ask them questions and come back and formulate how you can help them, because the idea is if they see you as an advisor, that's really the goal here. And take a look at your client base and their advisors, the care team they've put together, because usually clients will have, different doctors, clergy, different people that interface with them, maybe a trust officer or a CPA, or maybe their dentist or their ophthalmologist. So there's all kinds of people that I call a care team that surround your current clients. And if you really delve into what is their circle of influence, including any groups they belong to. And they may not be active anymore in some of these groups, but a lot of them, if they were active in the past, like to maintain relationships with people as they age. And as infirmity, unless it's a degenerative and progressive chronic disease, infirmity comes and goes oftentimes. So people might be in the hospital, be ill, come back, and then still be able to go back and attend their groups for a while before they have another cycle of a down spiral. And once you think about the access you have to these people, then also looking into other contacts that you know already and who might have the potential to be referral sources. So this really is a strategic approach to becoming a trusted advisor and to figuring out what's your best chance of getting into any of these advisors, to get in front of them, to ask them those questions about how you can help them. Now this is where we get into the other referral targets, and this is what we're going to focus on today, because if you, and this is really specifically for private pay businesses. Some of this might also relate to Medicare certified and Medicaid, but probably not so much. Maybe the elder law attorneys and the guardians. But this list here is a gold mine list. These are if you don't get as many, obviously, referrals from this group of people because they don't have hordes of people coming through every day in the system that have health care needs. But what they do have are generally long-term established relationships, and for private pay, it's long-term established relationships, and they may have a lot of these advisors also are working with people who have some kind of wealth.
Yeah, I think that list also comes into contact with a lot of people in that early awareness stage where they're starting to recognize something's going on with someone they love, and they're starting to look for more information. They might not be ready to buy yet, but they would be willing to take something that educates them about the changes that they're seeing.
Well, and they transform into longer-term clients in a lot of cases as well. So maybe you'll get less clients from these type of referral sources, but they will be much longer-term clients generally.
Yes, longer-term, higher hours. So great point. This variety that we have given you really fits into anyone who knows anyone with a care need as a potential referral source. So in addition to that list, you really do open up your potential for becoming a trusted advisor to someone who would refer. You open up that potential. So how is it that you become a trusted advisor? Well, number one, your service delivery has to be excellent. And I will say that as the competition increases, as more and more people enter into this home care space, as the number of aging people increases, that service delivery of excellence is going to continue to be more and more important. And I define excellence as excellent customer service, as consistency of staffing, as being responsive, as getting the right caregiver to the right place at the right time with the right skill set. So I mean, it really is a very well orchestrated service delivery system has to be in place. And then second, you really have to have a really good inquiry and intake process, because someone who is inquiring about care for their loved one who has a heart problem is not going to give a whit about the fact that you might have a lot of beautiful information about things that are not related to their issue. So that inquiry wants to know that you heard them, that you're going to treat their loved one as an individual, and you're going to, and when your response to them must be specific to what that person inquired about, and it must be timely. Marissa, you do a lot of those mystery shopping calls, and I know you've been astounded in the past at the response and intake and at follow-through.
Very true. It is rare, surprisingly, that I will get follow-up calls after those. They just don't check in. They assume you've got the information and they don't need to check back in. It's so important because it's just part of the whole buying process that somebody goes through when they're considering your services. And that follow-up call can be the game changer. And maybe it's not just a return call, but it's sending some more information that's about their particular situation that educates. You know, maybe they have a parent with Alzheimer's and you send them something on how to communicate better with their parent who has Alzheimer's. Makes a huge difference.
Yeah, I agree. That kind of attentiveness at the inquiry stage shows the kind of attentiveness that will be given at the care stage if they buy your services. So it should not be discounted at all.
And remember, back to our buyer cycle graph, we're still in we're in that second circle right now, where people are actually, you've been selected for them to call. So you've made it through that first awareness component, and you're into the second phase of that when someone is calling you. So and you also have the opportunity here to be a trusted advisor, because if someone calls you and it's obvious they're not appropriate for your services, that's when you can also make a referral someplace else. So, and then follow up with them again to make certain that they got in touch with that referral, that everything went all right. So, I mean, just because they're not becoming a customer doesn't mean that you don't need to continue that trusted advisor status.
Yeah, I think that's a great point.
We're going to go through some of these. I hope we get through all of them. Actually, I think we may have time to do that. But we have pulled out some of these referral sources that we are suggesting you become a trusted advisor for. And we're going to talk about, just go through, how do you get into these groups of people. And trust officers are really the gold mine if you can get in. And that's because if you're in a private pay business, trust officers have people as clients who have money. And so it does take money to pay for long-term care, particularly private pay long-term care in homes. So it really is a gold mine. And the key here is building long-term relationships. But this is where the trusted advisor component comes in. They don't know about home care. So you have the opportunity to educate them on home care, not just your home care, what do you do, but, you know, who's eligible for home care, and what are those siloed categories of home care, and how do they work together, and when is it appropriate for them to have long-term care at home that, like you provide. And then also the risks of hiring privately. Do you know the biggest competitor for the private pay agency is not the agency next door, it's it is the private caregiver. And there are groups of private caregivers out there who band together and are this underground economy, and they are out there staffing and taking care of people all over our country. So that's really the competition. The other thing is that benefit of oversight. Having that third-party oversight. I cannot tell you the number of times that I have had friends who did not choose an agency, hired private caregivers, and got and had bad things happen to them. So having that oversight from that third party is something you can educate trust officers, because the trust officer should be wanting to preserve the assets of the person, and the assets are not only the money that they're spending on care. So and you can get a general list of trust officers sometimes through a list company. It's harder to do that. You may actually have to find someone in that trust department and get the list of who's there. But when you get one referral from a trust office, that is the gold mine. And then what you do is start working on other people that work in the trust office and how to get information to them. And then what you really want to do is schedule time in front of the entire trust group. All of these banks, and actually the Bankers Association, State Bankers Association, they have meetings and they want to be educated about things that will help their customers. So it is possible to do that. Estate and trust attorneys, this is another category. Most of these estate and trust attorneys will understand the need for the agency to provide the care because they want that third-party oversight. And they also generally understand the issues of hiring independently. And I think those issues are becoming more acute as our population grows, and that caregiver scarcity is creating less of a desirable pool of people to work. The client for these estate and trust attorneys usually has money to pay, and also the estate and trust attorneys oftentimes takes that role almost of a surrogate family member and is the point of contact when problems arise. Usually if someone has an estate and a trust attorney that they work well and don't have a family either in town or close, then that may be your point of contact. And you know what? These people need clients as well. So you can offer to do joint seminars with them. Now, not the first time you meet them, but after they know you, trust you, understand your level of knowledge, then a joint seminar would be appropriate. So, and again, you're not actually, I've got promoting your business in here, but the idea is educating about what, the different kinds of care. I mean, you might bring in, to Marissa's point, other types of care options and do a seminar that really talks about what's appropriate for different types of care.
Yeah, a lot of these people have no idea what all of the different options are and when to refer where.
Yes, and here's just some other examples. The level of the lack of knowledge, the level of lack of knowledge, if I can say that. And Amy, you mentioned it in the medical referrals. It is extreme in all of these. But you can do a regular communication effort for estate and trust attorneys, and also you can work with the local bar association. These people, this group usually has meetings together just of estate and trust attorneys because they have issues that are relevant just to that group. So it really is a wonderful group. Once you get known by them and they understand your level of expertise, then you can get in front of them and present. And actually, they can get CEUs for listening to you if you're doing those things, educating about home care and educating about things they need to know for their clients. Guardianship organizations and court-appointed guardians, these run the gambit usually of people who have means to pay and people who are marginal, but it is also the ones that are appointed guardians because there's no family or because there are oftentimes adversarial relationships within the family, and the court might see that it's not in the best interest of the client, the elderly person or the disabled person, to have the family take care of them. So you have a real opportunity here to educate. Life planning is also a service that court and guardians need, and that is something, if you have the capacity to do that, it really is a service that's used in the courts to determine, for instance, a workers' comp claim or an accident insurance claim, how much money is going to be needed and what is the plan of care for that person for the rest of their life. Elder law attorneys. This is a unique group of people who oftentimes are focused on how does someone preserve their assets while becoming eligible for Medicaid, and depending on the resources, the person might want to spend down those resources so they can be eligible for Medicaid. So and that sometimes takes years. There's that window that you can't that you cannot transfer assets within, and if someone has not done that and they have to spend down their assets, then this is an opportunity to provide care for anywhere from a short term to a fairly long term. And just understanding those issues also will help build your capacity to be a trusted advisor. But you can get lists of these attorneys from NALA, and they are, they really do. You would think these people, because they're in the industry, might know more than they do. So, Amy, to your point, I think people will be surprised at how many people don't understand the different models of home care and what's appropriate for their clients. Now, if someone has long-term care insurance, obviously it might be something you would be interested in their knowing that you provide services so they can activate that insurance policy. The other thing is, a lot of people will call for long-term care insurance when that need arises, and they may not be eligible for it at that point. So you have a wonderful opportunity here to go to the meetings.
Another point with the long-term care insurance agents is a lot of times they end up wanting to just hand out lists of providers because of all of the, they can't recommend anybody specific. But if you're using that educational approach of being a trusted advisor to them, then everything changes. They can hand out your educational materials. So just a point to keep in mind for anyone that tells you they can only hand out a list.
Excellent point, Marissa. Just some different ideas about long-term care insurance agents, because there are going to be people that will call them that they're going to have to refer someone out to. They're either not going to qualify, or there's that elimination period, or perhaps someone might not want to use their benefits and might have limited benefits and not want to use them at that point. So different ideas for what to say to the long-term care insurance agents from a sales standpoint as to why they should listen to you. But Marissa is spot on when she says the way to get your information to their clients is by providing information that is value added, that is helpful information that agent can pass on. Retirement planners, the same. You're going to have probably less opportunity to get referrals from these people, but they're knowing about you. They are in a position to refer. I love their logo, by the way. Isn't that cute?
That's a nice logo.
When you're in the healthcare continuum and you are a private pay business, then trying to narrow your relationship to physicians who actually service clients that they could refer to you is something that will narrow that funnel. You know, in that sales process where you want as many people in that funnel as possible. But if you really narrow it down to those physicians who are servicing a population that they have the potential to refer to you, then just here's some suggestions on how to determine which physicians you should be trying to have relationships with. And I'll tell you, we mentioned here later, and I mentioned earlier about getting to physicians. A physician might volunteer or at least have a specific cause that they support and are involved with. And so if you're looking for common ground and common interest and you want to sponsor and be a or be a member of a group or find leadership in a group, then you could look and see which organizations would benefit you the most by the relationships you're going to make in those organizations.
Yeah, another tip on physician offices, but it also applies to other referral sources that you're visiting, is to build relationships with everyone at the place that you are visiting, because they might have influence with the clients that they see or with the physician. So, sometimes we go in and we want to just talk to the doctor or talk to the office manager, but the nurses, the CNAs, the reception staff all interact with clients, and having, making sure that you're developing a relationship with them and providing the same resources to them is a good practice to follow.
Well, and that falls in line with anyone who knows anyone who has a care need is a potential referral source. So excellent point, Amy. The other thing is our aging population is a chronically ill population, and there are diseases that relate specifically to aging. So those physician practices that actually service that clientele or have the potential to service that clientele are also going to be a better choice for you. So you can you can look in your client base and see who they're seeing, or if you do have a sales force and they're out, sort of targeting and canvassing and making cold calls, again, giving them information that finding out, go back to what we talked about earlier, finding out what it is that would make their life easier, and it might be tips on things to do when they come to the doctor's office, or things they can do at home to make life easier, or resources in the community. So you have a lot of options and a lot of possibilities to build yourself as a trusted advisor by simply figuring out what these people need that will make their jobs and their patients' lives better. Someone who comes into the Medicare certified world is going to have an end date of that service. So if they go from the hospital to a rehab center, or hospital to a nursing home, when that Medicare is exhausted, they may still have care needs. So it is important for people to understand that when Medicare ends, their care needs might not end, and you can really make some inroads with facilities that understand that.
Yeah, and I think if you're able to go, go into these skilled nursing facilities to do education that involves the attendees being able to get a continuing medical education credit for what you're offering, or continuing education credit, then you'll get a lot of attendance by offering that. Mm-hmm. It's something that they need to do anyway.
We have had a client in the past. They started the business, grew the business, sold the business, but they went, I'm pretty sure, from zero revenue to $8 million in revenue. And was it 3 years, Marissa?
I think that's about right.
I think it was about 3 years, and solely focused on what Amy just said, doing CEUs in the rehab centers and the nursing homes and the assisted living facilities in their area. Now, they were in a major metropolitan northeast area, but they did use that tactic, and it worked for them, obviously, very, very well. don't forget these Medicare agencies that don't have a private duty arm. Now, I would say the same thing from a trusted advisor standpoint for the private pay agencies who need to refer to Medicare, and also that need to refer to Medicaid, because the idea of a trusted advisor is that you have to understand the models of home care, and you have to understand what's appropriate for whom. So if you have a good relationship with some Medicare agencies that don't have a private pay arm, then they will logically talk to the clients, to their patients, when Medicare is ending, if they still have care needs.
I think in a lot of cases, focusing on this target is a much better bet than focusing on the discharge planners, because the discharge planners are more often focused on the Medicare cases because they know how that's going to be paid, and they just shuttle everybody over to these home health care agencies, whether or not it's something that they can service. So you are sort of the fallback guy in that situation.
That's an excellent point, Marissa, and I would agree with you. The other is geriatric care managers, who are soon to be known as aging life care professionals. But geriatric care managers, or aging life care professionals, by profession, are helping people navigate through this complicated system. And it is, if you have a geriatric care manager or an aging life care professional involved in the care of someone, it does allow that person to stay at home longer, because they're not just looking at their physical needs, they're looking at all of those other needs. You know, how do they keep the house in order? How do they provide a certain level of activities that the client might need, and what other areas in the client's life, the social area, just their physical environment, their spiritual activities, all of those things combined. So it does allow longer in-home care if a care manager is involved in a situation. And they do, sometimes care managers have their own groups of people that they recommend to hire privately, but for complicated cases, or something particularly now as finding staff becomes harder and harder, then it's a wonderful opportunity for a home care agency. Assisted living and retirement continuing care communities. Those assisted living, retirement, and continuing care communities are really interested in having people stay in their facilities. So any way you can help them, help their residents stay in place so they don't have to find another person to fill that spot in their community, is going to be of benefit to them.
Yeah, I would say I have seen the industry change in that some of these continuing care retirement communities, where they were designed for people to move from independent living to assisted living to the nursing home, have changed their philosophy that if they can keep someone in assisted or in independent living supported with outside services, that's actually better for that client than needing to make, a move to assisted living and then to the nursing center. It appeared to me that there's a trend that they would prefer to keep people where they are situated, because obviously making a move and change of environment as you age becomes even harder.
Well, and the other thing is, if there are no spots in a preferred community, then home care is a great option for someone to use until that spot opens up where they want to be. So it really is a mutually beneficial, can be a mutually beneficial relationship. So referrals going both ways. But you do need to think, this proposal to a menu of services, I will say that we sell a manual on working with retirement communities on our Market Home Care site. And the reason we do that is the model of providing home care, where you're charging for an hour or 2 hours or 4 hours, doesn't often work in a retirement community or these, assisted living continuum care communities, because someone oftentimes doesn't need that. They just need, they need you to stop in and, do a med set, or do a tuck-in or a wake-up, or do just a check-in. So there's oftentimes it's very small units of service, and if you are providing your services in the same way that you provide your traditional in-home services, you're going to be billing them in 15-minute increments, and if there's an issue, people you're going to spend a lot of time dealing with those 15-minute increments, and if you just do a menu of services, then it works out to be much better in these communities. Now, this is something that you don't have the funeral home director refer people very often, but when you do, it is a gold mine as well, because the statistics on the caregiving spouse dying before the spouse that needs care are pretty clear. So when that caregiving spouse dies, the person who's receiving the care still needs care. Now, the family oftentimes has no clue what to do, and there is a time period that you have a golden opportunity to provide that care at home and create a stabilized environment so that there is the potential for that person to stay at home long term. If they're not staying at home long term, then obviously you can help with wherever they're going to move. But for the funeral home director to understand that and have you top of mind when that situation occurs is great, because then the spouse that needs the care, that didn't die, will get care immediately, and it really is a wonderful opportunity. And again, in terms of educating people and information, there's although people are there obviously because someone died, there's still a wonderful opportunity, again, to be at that very first circle on the buyer process, the awareness. Because if you have a caregiving spouse taking care of the person who needs care, the family probably hasn't been involved that much. And oftentimes family doesn't even know how bad the person with the care needs is, because the spouse who's been doing the caregiving oftentimes will hide that. Real estate agents, just knowing about home care and knowing the opportunity for home care when someone decides they're going to move from the big house to a smaller house, or again when a spouse dies and the caregiving spouse dies, you've got the spouse that needs the care that is not going to be capable of staying in the house. So when the real estate agent comes in, they really need to know about home care, and lots of opportunities here.
And I think just putting that idea into their minds. I know with the funeral home directors, for example, and I'm sure this applies to the real estate agents as well, I interviewed a lot of funeral home directors across the country, and not one of them had been approached by a home care agency, and every last one of them had come across the situations that I mentioned where a home care service would be warranted. So it's just getting that spark into their minds of educating them of when that care might be appropriate. It's huge.
Well, I think the biggest issue with home care is that lack of awareness, and again, it's because you're not even aware of it until that need arises, and then you have this huge need for finding out information. So, and as you both have said, it goes to referral sources as well. Becoming active in the disease association that serve the needs of the chronic elderly. And again, it's attending meetings. You're looking for other people that have like interests. They obviously are there for a reason. So they either have a loved one there or they're a professional who wants to know more about it. So this is really a wonderful place. I mean, you're learning about the disease. You're building your educational capacity to understand how these diseases do work with home care, and you're also widening your network. So, and serving as a trusted advisor, that component comes in with when someone wants to know when do they need care, is home care appropriate. So, really good opportunities within the chronic disease associations. These are the ones also I would suggest sponsoring and searching for a leadership role in those. And don't forget your clergy. Go to your clients first and see what churches, synagogues, cathedrals that they attend, but or mosques, and but educating the clergy is, similar to the others we've said. They really, unless they've had this situation arise, might not understand the complicated nature of home care and how it is siloed and how it is so hard to navigate through the system and to know what to need. So you can really help them by being a resource and a trusted advisor. And even if they're not purchasing your services, as I said earlier, if you're helping them get to where they need to go, there will be that opportunity when something does fit. The same with CPAs. They generally are only interfacing with the client once or twice a year, but they oftentimes are someone that a family will call because it is someone they've been involved with. Now,
Marilee, before we go on to this slide, I just wanted to add one more, and that is your current clients. Don't stop educating them and being an advisor once they become clients. I think the more education you provide to your clients and their family members makes them more informed and more apt to refer your services to people that they know. So keep being a trusted advisor and keep being an educator to the clients that you already have, whether you do that through an e-newsletter that you send to them or educational seminars that you hold for them. The more that you educate them, the better that they're going to talk about the services that you provide.
In narrowing down this process to how do you become a trusted advisor, the first thing that we suggest is that you really do identify the segment that's going to make the most sense for you. And then we've gone through some examples of all of these. Decide how it's best for you to approach that segment. And again, based on what you can do for their clients. And you might have to interview them and find out what it is you can do for their clients so your approach is targeted and specifically how you can help them, and then put that plan in place so that you are contacting them regularly, that you are educating them, not selling your services, but educating them on things that they would be helpful for them to know or helpful for their clients to know, and then always look for ways that you can partner so that you will have mutual benefits, because almost all these people also need clients. So they may be referring to you, but you may have also the opportunity to refer their services to people. Amy has talked about this. We love this. We have our new little meme program going at Core Cubed, but bad salespeople are like bad dates. They're only going to talk about themselves. And to be a good salesperson, you really do have to listen. Push marketing is something that is aggravating to people, and it is very aggravating unless they have expressed interest and permission to contact them. So if you are contacting people and they have absolutely no interest and don't want to talk to you no matter what you've done, then let them go for a while, because once someone has expressed an interest in knowing more about home care, then that door is open to educate. But I caution you, people are really, the more and more we move into digital marketing where people have the opportunity to explore themselves, then the less they're going to be open to push marketing or to overt sales. So while you're building your referral source base, you really have to communicate that information to them that is going to make their job easier. And you really want something that is branded to your agency that they can pass on to their customer base. For your sales, you really have to use strategic sales processes, and I mentioned that before. You're starting at the top of that funnel, and you are trying to get as many people in that funnel, and you want to consistently work with them. If you support the industry by sponsorships or memberships in organizations, that's going to show, and that will also help people understand your interest is really in the industry and in educating and in supporting and advising and not necessarily just selling your services. And then that whole point is people are hungry for information about how to best accomplish the care at home for their loved ones, because most people do want to stay at home. And also, when is home care appropriate? Because there are those situations where it isn't appropriate for someone to come home. Either they can't afford it, or it's not a safe situation, or they're in a physical condition that home care really isn't appropriate. So, how do you do it? You communicate regularly, you offer helpful resources, you offer advice, you offer assistance, you educate on home care and related matters to not only those referral sources but the groups that they belong to, and you massage those relationships, you grow them, and you maintain them from introduction when you first met them at whatever, whether you went to their office or you met them at a networking event, until they do become that trusted referral and beyond. And the idea is you want them to think of you and refer to you when their clients or their patients have questions or care needs. And this is the goal. You really want referral sources to see your agency and you as an advisor as a resource. And when that happens, you're actually having them do some of your work for you, because they're passing along your message with their advice and referral. And so it really is a win-win. Before we take questions, would anyone like to mention anything that I've missed?
Can't think of anything that we've missed.
The first question is a list company that we might suggest. And I know, Marissa, you are our expert on lists, and I know they're complicated to use. So.
They are complicated to use. If you're looking to build a consumer list, that's one thing. There's a lot of great companies out there who can help you with that. But if you're looking to build a good referral list through a mail list company, it gets more complicated, because you have to understand NAIC codes and SIC codes and match those up with the appropriate referral source types. Some companies will not sell directly to a company. That you have to go through a vendor, and so it gets complicated. But we can certainly help you with that. Companies I might mention as reputable: USA Data, and some of these have been bought out by a couple of companies, but USA Data and Info USA are great companies.
The second question is providing CEUs. Now, normally the question is, wouldn't we have to be certified through some source? CEUs vary by state, and depending on the state, different levels of CEUs are needed for different positions. So first you have to know what that is. Then you have to go to the body that certifies those and present your material to them and let them approve that material. And I mentioned our MOST program earlier. We have had our MOST program PowerPoints, educational PowerPoints, approved for CEUs in many different states. So because they're sourced, they're educational, they're not sales, and so it is possible, and in a variety of different levels of CEUs.
Yes, there is some. Getting nurse CEUs approved is typically a much more lengthy process. There's a lot of red tape you have to go through and forms that you have to fill out. But when you think about the potential for getting clients from doing that, it's worth it.
As I mentioned earlier, this webinar was recorded, and it will be available on our Core Cubed website. It will be available probably in, I'd say, 30 minutes to an hour on corecube.com events. Here is some contact information for us. We certainly appreciate your time today, and I thank you very much. Marissa, thank you, and Amy, thank you. And
Thank you.
our time is up, and if you have any further questions, please don't hesitate to contact us. We'll be very glad to help you, and we hope you will take a look at our service offerings and that we see you again at webinars in the future. Have a great day, everyone.